Hello, one and all, and welcome to the semi-regular office hours for the career doctor. That's me, Dr. Anthony Llewellyn. I'm a experienced medical HR expert here in Australia and a real doctor, obviously. So I help lots of other doctors, lots of things actually, but in particular, one thing I help with is the medical career process here in Australia. So whether you're actually a trainee doctor here, or even a medical student, or a consultant, or you're just wanting to come here as a doctor, I can generally help you out with strategy, things like picking up your documents like your CVs, um, helping with job interview preparation, doing some career planning. I also help select a few clients out with things like um, developing their careers, leadership coaching, that sort of stuff. So um, we've just been kicking off uh, this process uh, with the officers. I haven't done live streams for a while, but I did one last week, and I had a few people join me. So I thought we'd go over a few random issues, and if you've got any questions or comments, you can certainly bring them over to the chat. So I'm just chat overlay, yeah. So thanks for joining me if you're joining. So I'm just going to try and make sure I've got LinkedIn up because I don't automatically get notified if I have a notification over there. Um, so I'll see if we can figure that one out. There we go. I've got that now. Getting that loading. Want to load. Sure it's muted. Okay. We've got one person joining. If you want to ask a question, by the way, just whack it in the chat. Whether that be on YouTube or Facebook or LinkedIn, as I say. I'm going to put LinkedIn over to the side of my other screen so it's not as distracting for me. How is everyone today? So, last time I sort of went through some of the questions on my YouTube channel, and I thought that we could go back to doing that. But one thing I also wanted to just um, point out is uh, screen share. Try that again. Um, if you are wanting some in-depth assistance, then I do offer a strategy call. This is risk-free, so that means if you don't um, find that you get the value from it that you uh, what you order, then we will refund your money. That rarely happens. Most people do get value out of it. Done close to 1,000 of these so far. So if you've got a particular query about your situation, I would recommend that. There's the web page for that, coaching.advancedmed.com.au /strategy hyphen call. But I'll just hide that while I bring up YouTube, and we'll have a look at some of the questions that I didn't wasn't able to get around to last time. My chat. It'd be helpful if I was in the right account. that up then. I'll monitor the chat over here in case there are still some messages popping up. Yeah, so why don't we start at the top and then do a couple and go to the bottom and see how we go. And we'll take it from there. So, hello, doctor. Does the 10-year, blow this up, 10-year restriction means you cannot even study further, for example, do any fellowship program? Also, suppose I'm an IMG and I want to return back home, leaving Australia forever after becoming general practitioner. Will I be able to do so? Okay, I think you probably need to consume a bit more of my content, Prakash. Um, uh, uh, Essentially, the 10-year restriction about where you work does not inhibit further training study. So many people come via the standard pathway or the competent authority pathway or a range of other pathways, and they are subject to this 10-year moratorium. I feel like I might have even gone over this last week, but if we go to 19AB moratorium, we'll see this is a Australian Commonwealth Government initiative. And it affects both overseas trained doctors as well as international students who come here to study medicine. Okay, there are some exemptions. They're fairly restricted, but there are some exemption categories. And basically, so basically, to access Medicare benefits for you as a doctor, i.e., get paid through Medicare for seeing the patient. See, bear in mind that Medicare is the main income revenue stream for all specialists, including general practitioners who are specialists in Australia. You need what's called a provider number, and that provider number is linked to a practice location. So the Commonwealth Government can restrict where you work based on restricting provider numbers, and then they do this if you're a GP based on a not quite a formula, but a process called the distribution priority area. They work out which areas in Australia are okay for you to work in and which are off limit, and a similar process with what's called the district of workforce shortage if you're a non-GP specialist. But this only applies if you are a specialist. So if you're training in the hospital, for example, or even if you're working as a consultant specialist in the hospital, you don't really need to access Medicare. Your activity is being funded through another way, and you're being paid by the state health system. Where it does come into play is if you're a GP or a GP trainee. GP trainees are all that's all generally funded through the Commonwealth Government, and general practice trainees therefore need a provider number. That's a special case for trainees having a provider number. Or as I said, if you're working privately as a specialist. So many people come here and work for several years through the state hospital system before this 10-year moratorium ever affecting them, and they often finish with only say 1 or 2 years where they're affected by this. There's always debate about these whether these processes are working well at the moment. The restrictions have really been with COVID. There should be the health workforce locator here somewhere to show this. Let's do that. With COVID, they sort of widened what was a distribution distribution area, and the problem there is it's meant that even in some of the major capital cities, GPs can work under the moratorium, and that's really a problem for people in the country because it means there's less doctors being pushed into the country. So you can check out the locator here, and you can look at it for GPs. Go down a bit, one more. You can see yellow means you can work. So pretty much all of, I think if I zoomed right in on Tassie, you might find a little area in Hobart is off limits. But you know, most of Australia, you can work in as a GP at the moment. And you got to pick the one for the specialist you want. But let's say we pick my specialty of psychiatry. Similar thing, you can work in every major capital city. It's just there's certain suburbs you can't. So is it doing its job? I guess there will be a question over that at this point in time. So thanks for that question, Prakash. I'll just check if I've got any other questions from the chat. Welcome if you're joining today. Question, should we have IELTS results ready prior to application? So IELTS professional. I didn't even know an IELTS professional. The PTE academic and then there's a PTE normal, and you need to do the academic. But here you can go straight to the you should always go to the source of truth. I'm happy to give you my advice and opinion, but always check it and check it with any other source on the internet, obviously. But it's the IELTS academic, and IELTS academic. Colleges expect English language test prior to and that's on the basis that there's really no point assessing you if you can't meet the English standards. And I think that's fair because then you don't end up spending a lot of money when you could have just done a simple test. Cool. All right. Let's jump down to the bottom now. Last time it took a while to get to the bottom. If we're at the bottom yet, I think we got all the. We've still got a few 5 months. So apologies if you've been waiting for an answer. I will try and get through to clear the backlog. Basically, I'd had this idea of doing a live stream where I answer some of the questions. I just hadn't got around to setting it up last year. So Dr. Sarabi 10, thanks for the information. I'm from India, done a psychiatry certificate. I have helped, I am a psychiatrist, and I have helped a number of psychiatrists in the past. I currently work for the College of Psychiatry, so I don't provide any individual support. So if you're looking to do a strategy call with me, I wouldn't be able to do one with you, unfortunately, Dr. Sarabi. This is a fairly long-winded question about what pathway is best for me. And my rule is that I sort of only answer, I try to provide simple answers here. A lot of the information you provided to me is not really relevant. Seems you would be eligible to apply for a specialist pathway. With a probable partial comparability outcome. There are obviously other options. Feel free to review my other videos on the other pathway? Thanks for your question. Addy 986107524. So if you are a urologist in India, you can apply to the Royal Australian Australasian College of Surgeons. Bearing in mind that the Royal Australasian College of Surgeons do have what we call, often referred to as RACs, do have fairly high standards. And the one piece of advice I always give to candidates looking to become a surgeon here from elsewhere is they have historically have the lowest lowest favorable comparability rate. So it is one of the hardest things to achieve. Back up to the top. If you've got a question, put it in the YouTube, LinkedIn, or Facebook chat. I get all the Facebook and YouTube directly to my software here. And I've got a browser open on LinkedIn so that I can see if you've got any questions there. Although it doesn't seem to be loading, which is interesting. But I can see I've got some other people watching in other places. If you're wanting to get more in-depth advice with me, I do have the strategy call over here. But we might just knock off a few more community questions. Just refresh this. Hi, Anthony. I'm a radiologist from Germany. In Germany, studied medicine here, included my specialization. Want to move to Australia to work as a radiologist. I have experience in all the normal radiology things. Hi, the specialist pathway is the correct pathway for you. Bear in mind that it's not everyone succeeds. I was just talking about the Royal Australasian College of Surgeons' overall favourability or comparability rate. The interesting thing about radiology, and I will share these statistics once I kind of get them in a video nice format. College of Radiology has a very high rate of comparability assessment in the high 90%. But the issue with radiology, so it's likely that you would be assessed as comparable. The issue with radiology is there's probably approximately 2-to-1 ratio of radiologists from elsewhere who've been approved for the pathway by the college versus those doing the pathway, i.e., there's a bottleneck for jobs. That's probably because the college is finding everyone not just comparable, but partially comparable, which means they are competing for training jobs along with the local trainees, and there's just not that many around. So it's a situation which I call a license to hunt. You get approval from the college, and then you've got to go through the difficult process of trying to obtain a job, which doesn't necessarily happen. So one of the problems with the specialist pathway is there's not a lot of information to specialist IMGs about the not just the demand for the specialty, but the opportunity that they might have. So there's a difference between, and most specialties in Australia we need more of, particularly in the regional areas and the rural areas. But that doesn't necessarily mean you'll get a spot, because often the college is saying you need to do a training spot, and there may be some limitations on the availability of training spots. What we call a capacity to train issue. So it would be useful if there's a bit more oversight, or not oversight, transparency around some of those issues. Glad it was helpful. I'm not sure which video you're referring to. I'll have to go and timestamp that one then, I guess. You did say it was helpful, so let me get back to that one. I'd have to watch the video to find out what's not appearing at 142. Presumably, I've got a what do you call it? A tile at 142 linking to another video. I do a lot of videos, so I wouldn't know what that was linking to. Let me know if you've got a question or a comment in the chat. We'll go back down. You are welcome. So Jane, and I've got a couple more here. Okay, so we've got someone who's been working in the NHS in psychiatry, both the community and inpatient experience. Yes. Please try to keep your questions reasonably short, because often I find there's a sort of a confusing trail of information, and this is where it gets into individual advice, and you're much better off doing a strategy call. It's hard for others to follow the train as well, and for me to kind of give you a quick answer here, which is the point. Yeah, look, you're asking a bunch of questions there. You haven't told me whether either of you are UK grads or have come from elsewhere. I'm assuming from elsewhere. Um, uh, yeah. So it's a bit unclear to me what your best options are. I would suggest a strategy call. It seems you would either be eligible for the competent authority or standard pathway. And if you've been training, you may be eligible, training in psychiatry, you may be eligible for some recognition of prior learning. But yeah, if you've got a question, again, I'm very happy to answer questions. It's for your benefit, but also for the benefit of others who might be are thinking the same thing. But just, yeah, it's helpful if you can kind of keep them reasonably short, because it's really hard on a vehicle like YouTube or Facebook, etc., to kind of do a detailed answer, because often it's like, well, do you have this or that, and then it's backwards and forth, and that's why we have the strategy call for people as well. Okay, we've got a UK person who studied in Italy, completed foundation. Yeah, so, well, yes, you can, but I have plenty of European doctors tell me that the GMC will not let them sit the plab. And I'm wondering what's happening with the UK MLA. I mean, that was supposed to have come in. And there's no, like, I was assuming our medical board would have some information about it as well. But everyone seems to be doing the plab still. Probably worth us Googling. Yeah. So it says it will test. I thought is this intended to be in already, but yeah. Let's see what they say. Yeah, in 2024, we're introducing the medical licensing assessment for both medical students in the UK and IMGs who want to work in the UK. Interesting, because I'm still getting people telling me that they're doing the PLAB. So, and the medical board here in Australia has not updated its information from the PLAB for the Competent Authority pathway to the UK MLA. So I'm assuming Maybe someone knows. Put it in the comments below. If you're from the UK, you can probably kind of um, uh, um, let me know. Interesting. That's the person who. That's the company that owns WordPress privacy policy. Interesting. Why have they got a link to Automatic, which is the company that owns WordPress, off the General Medical Council? Oh, okay. Oh, I think this is a GMC website, but it's a WordPress website, but it seems to be a work in progress. That's very interesting. It's not for an official body. You would think they would have picked up some of that stuff. I'm assuming this is official. Again, someone could let me know. That would be helpful. In any case, the medical board here is still working off the PLAB for the Competent Authority pathway. No, I've already replied, haven't I? Okay, we might hop to the top. Just refresh. Got a question? Put it in the chat. Okay, well, thanks, but you're obviously promoting your own software. I have developed my own chatbots that, they can do a bunch of good stuff these days. And I'm using them with my clients for things like generating new questions to practice on, or helping to refine your key statements on your CV and stuff. So I think it's going to be come uh, going to become common practice in many aspects of medicine. I myself have been using an AI scribe for recently doing a locum. So the technology is there. You've obviously got to um, uh, you've obviously got to check it yourself because it can make errors. Um, um, we've got a comment from LG. Happy to see you on one of the My Health Learning modules. Okay. So you've seen me somewhere else, have you? Oh, okay. Yep. Yeah, I think I did. I think I shared with someone. Which one is it? LG. Can you share the link? Cool. Again, I think someone's trying to promote their tool here, but uh, um, I recommend and use Visual CV with my client. I do have a Visual CV affiliate link somewhere. Maybe I should figure that out and put that in the comment there. But so if you work with me on your resume, you'll get a license to account. And we'll do your resume together, and then you can manage it for the next 12 months, and extend it if you need it. Do I think didn't have to remember to click on reply here. Do I think the New South Wales junior doctors will strike? Look, I, you know, I don't think I've got enough sort of inside intelligence to say anything more insightful than what most people might tell you, Mark. When I was an intern at Canberra Hospital, we had the last New South Wales junior doctors strike that I think went for a week or so. I believe it was over the same stuff, paying conditions. We've obviously had the New South Wales psychiatrists, a lot of them resigning. There's been a tension for the last year and a half or so around the the awards for trainee doctors. I mean, there's been lots of negotiation for many of the state awards here in New South Wales. A frustration about the government not coming to the table to negotiate, and I think obviously had the unfortunate comment about the clinical marshmallow from my old stomping ground at John Hunter Hospital the last week, I think that was, which has kind of spurred a lot of stuff. Um, it's interesting that, again, when I was an intern in New South Wales, I'd have to go back and look at the historical documents, but being interested in these issues, I recall that uh, being a trainee doctor in New South Wales, you generally had some of the better pay and conditions in the country, and it seems to have eroded over time. I think uh, the one state there's been a couple of states that have kind of been traditionally over the last few years behind New South Wales, which were South Australia and Tasmania, but they've recently jumped, leapfrogged, and so New South Wales, in a lot of ways, is clearly behind. In fact, I do have a post for anyone who's interested in comparing things. Probably needs a little bit of update in terms of some of the awards might have been revised. So the conditions might have been revised in the last 6 months or so. But if you do advanced med doctor pay rates, you'll get this post. And the reason I wrote it is that it's not just about salary. Although you've got a salary comparison table there, so you can see at the moment. And I think this is, I forget when I've updated this. So these are up to the end of 2023. So I think a few of these would have changed from last year. But you can see this is when Tasmania had updated. So we've clearly got New South Wales the lowest for interns, and the lowest for residents. When we get up to registrars, still the lowest. That's GP registrars, so that they sort of switch over a bit quicker. Yeah, pretty much tracking behind everyone else, and then a lot of the extra conditions, which is what I wanted to sort of highlight to people here: these penalty rates on calls, etc. They're fairly standard. The super is pretty standard. There are issues in New South Wales about the travel and accommodation and stuff. There's no professional development leave for trainee doctors in New South. Well, there is, but it's really hard to access, and there's no funding for it. Whereas there is generally in other states now. So there's some of the other things that trainee doctors get in other states, New South Wales doesn't get. So if you were to put that all together, you would clearly say that there is the state that has the worst conditions for trainee doctors in South Wales from a pay and other benefits as an employee, New South Wales. So I hope that kind of gives you an insight. What can I say? I mean, I don't know. I hope not. I hope there is some genuine discussion. I do feel a little bit for Chris Minns. He made the point. He's the Premier of New South Wales. He made the point the other night that we've had 12 years of a Liberal government with stagnating wages across the public sector. It is hard to fix everything in a year or two. I get that, But I think there's been a genuine desire to actually talk about these things and a bit of stonewalling. Um, yeah, I do hope there's some genuine discussion. Uh, it's clear on the facts that New South Wales is, near the bottom in terms of pay and other conditions for trainee doctors in Australia. And that's a problem if people can go to other states, which they sometimes do. So I hope that kind of answers um, your question there, Mark. A bit interesting. So apparently it's LG, the learning module. It's on this. So is this the one with New South Wales Health with Hetty? Because there's another My Health Learning, like as a private company. So I'm assuming it's a Hetty one. Yeah, I was involved in developing a number of resources when I was the medical director at Hetty, and there was one on supervision and feedback. Yeah, that I was involved in. So that makes sense. Cool. All right. Excellent. So, what should we do with the remaining time? I did have a thought, because I often get, I got asked a question in one of my courses the other day about competency framework, and this might be worth just running through a little bit. So, um, this I think is useful to both doctors in Australia, as well as those outside of Australia. Um, so I find this, I call this the best kept secret in medical HR. And if you've read any job descriptions, you'll probably get what I mean when you um, understand what I'm talking about. So, um, yeah. So we have an interesting specialty college in Canada called the Royal College of Physicians and Surgeons of Canada. So it actually includes anaesthetists and psychiatrists. It's everyone apart from general practice, is my understanding. So it's an interesting college, and I think because of their nature, I think they think they can think about things slightly differently. And in the 90s, in fact 96, they launched this CAMED framework, which is a competency-based medical education framework, and it was a piece of work that sort of described the key roles and then what's set under those roles for any sort of doctor. So you may have seen this diagram before, but more likely you've seen a version of it in other colleges. So if we go to, let's say, RACP professional framework, um, you'll see that if you compare and contrast, this is similar. There's some additions, and this has happened over time. And the thing is, pretty much every specialty college has taken advice from the Canadians. They've often had the people who've been involved in developing CAMEDs come over here and help out. In fact, my college, the College of Psychiatrists, if I can just find this quickly. There's no diagram there, but you can see it's literally the same, and we are currently revising it. The piece of work that I'm actually involved in. RACS, the College of Surgeons. Yeah, I think we'll go to their competency guide, which is excellent. If you're, by the way, if you are appearing for set interviews this year, I do recommend you go through this guide. It gives you a lot of good terminology around what College of Surgeons is looking for in a surgeon. But again, you'll see they've got this framework over here with, interestingly, a lot of them have now moved, or well, actually medical experts still in the middle with the RACP, but I've seen a lot of them moving it out and then putting patient-centered care in the middle, so making this more around the patient, which I think is I personally think that's a better, visually looks better to me. You can see again they've got similar roles, but with additions like technical expertise, etc. So the point here is, if you're a trainee doctor applying for a college, usually the college selection process will be based around these competencies. So you want to go to the framework and you want to understand it, and you want to not just see the pretty picture, but read a little bit like you can with the RACS about what they mean by medical expertise. So this is, I love this sort of approach because it kind of gives you a bit more detail in terms of the actual competencies that they feel support good medical expertise, and examples of good and not so good behaviours. I've seen this with the anaesthetist as well, and I think that's a really nice way of sort of laying it out. And then if you can understand this framework, you'll understand a lot of the rationale for the questions you get in the selection. You'll be able to answer them because you'll. The other thing I advise people is to prepare with this framework. So think about, how might I be asked about my ability to be a medical expert? What sort of examples do I need to provide? So do that in your preparation. And this is similar if you're coming from outside, for example, especially if you're applying, well, particularly if you're applying to the college as part of the specialist pathway, you would need to understand this framework as well. So yeah, and you'll be able to find one on every college website. There'll be something similar looking to the ones I've shown you there just then. So I thought it'd be helpful to go over that, and I might replace the video in my course that I've got on this because it's a little bit outdated. Similarly, a quick thing that I wanted to do for IMG doctors who are applying via the specialist pathway is, where do you go on the college website to find the information you need? So let's just do a couple of examples. I'm going to do the RACP because that's a very common one. I won't do the RACGP because their website's very often very complex and hard to navigate. Probably worth me doing like a separate video on. What else will I do? Maybe let's do radiology. Just as two examples, okay? So let's say you're a general pediatrician or a adult cardiologist or whatever. A lot of the specialties head towards the RACP. So if we go to the landing page, see most web colleges will have a big header for specialist IMGs. You go to become a physician, and you go to overseas trained physicians. Okay, so we'll click on that. Now let's see if we can do it with radiology, because I think it's probably, if I compare them, it's going to be slightly different. And like yeah. So the college, our work, contact us. Membership. I'm thinking we're going to go with membership here. Oh yeah, and so then we get a subheading, which takes us to international medical graduates. So it's different for all. What I would suggest is actually often easier. You want to try through going to the college landing page, but if you do something like RACP SIMG assessment, often get what you want quicker. And this is in fact the page that you want for SIMG assessment in Australia. So so that's the RACP page, and so most of them will have some information. This one's this one's for all the specialties they assess. Which, so if you've got a unique specialty, and you're not sure which college, as I said, the College of Physicians here in Australia and New Zealand, it has by far the largest number of training programs. I don't know how they manage it all. And then There's contacts if you want to ask a question. And then you'll have definitions, and then resources. And so you got things like requirements for translating a document. So don't just go and get any random translator to translate your documents. It has to be someone that is approved. Um, this is a very key document. Okay, this is the sort of shows you what you have to do and what the process is, and kind of it's not the policy. There is a policy that you can review as well, but most of them will have some sort of handy document that will step you through the process. I believe this is a link to curricula. Now the problem here is the physician college is revising some of their curricula, and some of them are now paywalled. You know, the locked behind a login basically, which is an issue. They need to sort that out because it's unfair to ask someone to pair themselves with the local requirements if you can't show them what the curriculum is. I presume if you contact them and you can't get the curriculum, they will send it to you. I have historically struggled with the College of Surgeons, well, not actually the college, the specialty societies, with them not being responsive when you request their curriculum. So hopefully that doesn't happen with the RACP. There's also a link to fees here. So you'll find all this stuff. This will be similar on most other college sites. Some of the smaller ones are not as helpful, don't have as much information. This one, I think I found that you end up going a roundabout. I don't think they've actually updated their fees for 2025 for uh, specialist assessments. So if anyone from their College of Physicians is watching, this link takes you through to the training and exam fees. But it doesn't include the IMG fees or the specialist pathway fees. So you would be helpful to update that. And what else was I? And so so we've got documents down here. They're probably all so you can see all the key documents there. So if you go to the College of Radiologists, you'll see similar. There's some information, eligibility, how to apply. There's a policy. I think they've got a guide somewhere here as well. There's a CV template that you have to fill in. Link to the fees. Yeah, there's the assessment policy, information about reconsideration, stuff about what happens afterwards, etc. No guide though, that as far as I can see. And so the other key document you want, so you can find all the how to do it pathway documents. But then you want to do that comparison. So how do you go about doing that? So with the College of Physicians, again, it's a little bit more complicated because they have basic training and advanced training. You should look at the basic training, but really I find the focus is on the advanced training. So you can find the links for basic training. So let's just say you are, let's go with respiratory because I think that's still available. Let's say you're a respiratory physician from somewhere else. So you would look at the adult internal medicine basic training documents. So they're here. Okay. They all tend to be like 60 odd pages. So there's a lot of reading there. And then we'd also go over to advanced training. And respiratory and sleep medicine. And this is the 24 handbook. And you'll see there's the adult and the pediatric version. So if you're adult, obviously adult version. And so you'll get a document that looks like this. One particular thing to find in here is what I call they usually call the graduate outcomes, because that's basically defines what the standard is for base standard once you finish training. So that's something that you can compare yourself to. Um, and then you'll see there's all these sort of curriculum and learning objectives that you have to sort of go through to see how your training and your consultant practice compares. Um, and then the other thing with RACP and some of the other colleges, again, you want to look at their professional qualities document as well, which is generally intended for fellows or consultants in the college, but again, gives you some information about what the standard is. So that, again, you'll get that sort of document. So what do you do with radiology? Radiology is a little bit simpler because they only have two specialties. Here we go to trainees. Let's say you're a radiologist, not a radiation oncologist. You've got the clinical radiology training program here. Click on this, and we should get both handbooks. Yeah, so we've got the learning outcomes, which is kind of their curriculum, if you like, their term for their curriculum, and then the training handbook. So they are the key documents that you're looking for when you're doing a specialist pathway assessment. I might get my editor to chop that up and the one I did before into a bit of a video to help with YouTube and my courses. So we're getting close to the hour. If you've got a quick question, I still have a little moment. We can probably just hop back to YouTube and quickly do a couple more questions. Why I haven't. See if we can knock off the 5 monthers. And we've got a few from 4 months. This one's the same. So I'm an Indian citizen who recently graduated from China. 1 year. Actually, I might not answer that one. I'll put C answer. I guess I could duplicate it, couldn't I? Okay, so you've graduated in China. You've not worked. You're not registered. Will you be able to join once you clear the AMC exams? Look, basically, you are on a difficult path. Want to start in Australia, you would be best off getting some experience in another country first. There are options for international medical graduates who haven't done an internship to apply for internships in Australia. But as I say, each and every time when I mention that it is very rare, it's probably less than 10 doctors a year, and it's not something that you should rely on. The internship system in Australia is designed for the Australian and New Zealand interns, and so its capacity is built around that. There have been some shortage, there has been some spare capacity the last couple of years, so probably a few more international students getting in, but you should definitely not rely on it. You are better off uh, getting some experience and applying through the normal process, the standard pathway, which is for an RMO job. So, a question about partial comparability. Yeah. So your PC status, approval status, I guess it is, depends on the college. They all have details about what happens if you haven't got a job in the specified time frame. you should consult. Go on the college website or contact them. Generally, at a certain point, you will need to do another assessment. And this is what I'm saying. With some of them, you get a favorable assessment, partial comparability, um, but you don't necessarily get the opportunity because there's too many people competing. Um, and so it's worth understanding what your chances are, not just of getting through the specialist pathway, but also getting a job afterwards. Um, um, and look, I actually do a lot of calls with clients where I try to explain that their chances are really slim for certain specialties, like some of the surgical specialties. And again, it depends on individual circumstances, but I see people where, from my experience, I know that their chances of getting assessment are pretty limited, or the chances of getting a job afterwards are pretty limited. And I basically um, try to be as open and transparent about that as possible, and then they decide they still want to go through with it, and it makes me a little bit uncomfortable because I feel like if I'm helping them, that it's they're going to be disappointed at the end. So it's I'm very happy to help anyone with the process. Generally there's a possibility in most circumstances, but I think it's important to kind of know upfront some of these this information, so you go into it fully informed, and so you're not hopefully not too disappointed when you don't get the outcome that you're looking for. Are STTP accredited by RACP, and will they provide a certificate of training after completion of the said period? So we're talking about short-term specialist training in a medical specialty pathway. Um, so hi. According to, let's just uh, this is what I'm saying about Google. Probably a better way at finding things on college websites at times. So short-term specialist training is different from specialist pathway. It's basically an opportunity to work here for up to 2 years to get experience to take back um, to your country of origin, essentially. Uh, and um, so the official line from the RACP, and they may even detail this in more detail elsewhere, is that it's not accredited. So, so the way the system works is if you want to do short term training, and this is different to the specialist pathway, you have to find a job. So you have to be given a job offer by an employer somewhere in Australia. You then apply to the college on a paper based application form. You don't have to interview. It's more streamlined and it's cheaper, and they have to approve it as a training position, and then you can get your registration and start your job. So to me, it seems a little bit counterintuitive or paradoxical that the colleges are approving you to come here to do training, but they're not recognizing that training in any way, shape, or form. And whilst, it's quite clear and uh, proper that this is not about you doing fellowship training here, the question is, how much can you count that training for something else? And so this is where the dilemma comes in. Um, and so the dilemma is, what happens if later on I want to apply for the specialist pathway? Can I count that training? The short-term training in a medical specialty pathway is not meant to be used as a step towards specialist pathway. However, many people do start on that pathway and then later on apply via the specialist pathway or do something else like the standard pathway. So it does happen. And I think it would be, and I'm actually not, I'd have to go look at the RACP policy. So I'm not saying that they won't take into account if you do a specialist pathway application. Um, but some colleges will be, have information saying it cannot be counted towards it. And I think that's a bit difficult to say if you have already signed off on that period as additional training. So it's a bit of an untested area at the moment. Well, that's brought us to the end of the hour. So thank you all for joining me. Hopefully that was helpful. I will, let me just check. I think, so aiming to do this every Friday, 10 a.m. Sydney time. Happy to sort of have suggestions about the sort of content you would be looking for. And yeah, I'll be online next week as well. I'm going to be away the following week. But thanks for joining me today, and hope you have a good rest of the day.